Hey guys, did you know that approximately 40% of Americans will be diagnosed with cancer at some point in their lives? And that patients afflicted with cancer show increased rates of suffering from psychiatric illnesses such as general anxiety disorder, depressive disorders, and the list goes on. Some estimates state that this increase is as high as 30 to 40%. Thankfully, there's a growing body of scientific literature that suggests that certain psychedelics such as psilocybin and LSD in conjunction with psychotherapy may hold the answer. Administering doses of psychedelics to patients with the right setting, dose, and psychiatrist has shown phenomenal decreases in psychiatric illnesses in patients. In one study, anti-anxiety effects of psychedelics decreased anxiety by 58% and depression by 83%. 70% of patients in this study rated it in the top 5 most meaningful experiences of their lives. Now let's dive deeper into these topics by examining the history of psychotherapy use in America. Valentina Watson and Aldous Huxley are two of the most influential figures that helped popularize the spiritual effects of psychedelic use in America. In the 1950s, Valentina and her husband Gordon were the first Americans to participate in an indigenous psychedelic ritual. The ritual took place in a small, largely undiscovered town in Mexico. Maria Sabina is a native woman who agreed to let them partake in this ritual, as long as they swore to not tell the general public. After completing the ritual, Valentina and Gordon Watson's lives were changed. They went on to disregard their promise to Maria and they wrote about their experiences in the Life magazine. In her expose, Valentina wrote that she predicted the future of psychedelics would be psilocybin and they'd be used to treat all sorts of mental ailments. The majority of the general public had never heard of psilocybin before, and they were astounded by the mystical experiences that the Watsons had. The other figure that helped bring psychedelics to be acknowledged as an agent for psychological change is Aldous Huxley. After taking mescaline in 1953, preeminent author and literary giant Aldous Huxley wrote about his experiences in his book Doors of Perception. In this book, he stated that untapped consciousness exists ubiquitous throughout the world around us, and our bodies act as a reducing valve that only allows us to see a fraction of reality. He called this theory the mind at large. In his book, he also wrote about how all worldly religions are derived from the same metaphysical truths, and that these truths are the foundation of all major religions. He called this the perennial philosophy. Doors of Perception was a hit. It helped the general public understand the mystical and spiritual elements of psychedelic usage. While Watson and Huxley were responsible for popularizing psychedelic usage and laying the foundation for psychedelic research, thousands of studies were conducted on psychedelics. However, psychedelic mediated psychotherapy didn't take off until the mid 1960s through the 1970s. During this time, researchers at the Spring Grove State Hospital were experimenting with psychedelic mediated psychotherapy with terminal cancer patients. The researchers paid close attention to setting, and dosage during the therapy. In the 83 people that participated in this study, 73% of them experienced a phenomenal decrease in anxiety and fear related to death. While the research proved psychedelics to be instrumental in the field of psychotherapy research, that didn't last for long. Due to the fear surrounding the counterculture movement of the 1960s, psilocybin and LSD were labeled Schedule 1 drugs and research came to a standstill. It wasn't until the past decade that psychedelic mediated therapy has become possible again, albeit mainly for research purposes, because the psychedelics used in therapy are still legal in most states, besides Oregon. However, researchers are once again able to perform psychedelic therapy to see if it is an effective treatment. One recent meta-analysis by Stephen Ross consisted of 10 clinical studies, with a combined total of 445 participants, that examined the effects of serotonergic psychedelic therapy on terminally ill cancer patients suffering from acute psychiatric illness. In the majority of these studies, significant decreases in depression and anxiety were observed. The studies showed that the greatest reduction in depression and anxiety were those who used LSD as a psychedelic agent. Meta-analyses are important because they take the data from multiple studies and find common themes and patterns in that data. The pattern that Ross found is important because it shows that in all 10 of these studies, psychedelic-mediated therapy helped improve the mental states of terminally ill cancer patients. This shows that psychedelic-mediated therapy has promise in the field of psychotherapy, and that this data highly supports the beneficence argument for the pro-psychedelic therapy side of things. While Ross's study and similar studies look promising, they tend to be small and contain a certain amount of bias in the researchers administering them. This primarily happens because psychedelics are difficult to control for. When conducting the trials, it is obvious to the researchers who has taken the psychedelics versus the placebo. There are also bad trips, which consist of patients hallucinating negative imagery. These bad trips can trigger schizophrenia and other mental illnesses in people that are predisposed to those conditions. Bad trips aren't the only thing to worry about. According to research done by Villanueva and Prescott, trauma is able to happen during the psychotherapy that can make the mental state of patients receiving therapy worse than it was before therapy. These traumas primarily consist of therapists encouraging emotional dependency from patients, therapists not following traditional psychotherapy conduct guidelines, therapists using the incorrect setting, and dosage, and therapists sexually abusing their patients while the patient is on psychedelics. While the negative sides of psychedelic-mediated therapy should be acknowledged, certain techniques and guidelines can prevent these traumas from occurring in the first place. This is a point that Gashi and associates argue in this study. They found that framing bad trips with a positive, structured frame of mind can be an extraordinary tool for facilitating the creation of meaning out of bad trips. Also, having the correct setting, and dosage during psychedelic-mediated psychotherapy can help to mitigate bad trips. Addressing shady therapists who abuse their power during this therapy is a difficult challenge. Creating ethical guidelines when performing psychedelic-mediated therapy and creating licensure requirements to be able to perform this type of therapy are both potential solutions to solving this challenge. The ethical dilemma of psychedelic therapy for cancer patients has both positive and negative sides. Based on the evidence, it seems to me that the pros of psychedelic therapy for cancer patients outweigh the cons. In nearly every study I've found, terminally ill cancer patients experienced a reduction in their anxiety, depression, and they were able to find a new source of meaning in their lives. However, this is my own personal take, and I acknowledge that the cons of bad trips, wayward therapists, and other risk factors could make life worse for people that are already struggling. I will leave it up to the viewers to decide for themselves which side they will choose.